Hello everyone. The topic of presentation is hearing aids care and maintenance. Myself Pranjali Ujawane, an audiologist and speech language pathologist working in the AYJNISD, Mumbai. Why the hearing aids care and maintenance is important? Because the good amplification is vital factor that determines the outcomes in rehabilitation of a children with a hearing impairment. It is the foundation on which oral rehabilitation is built. The consistent use of a well-functioning hearing aid ensures the child gets a maximum possible auditory inputs from the environment to enable him or her to learn the speech and language by listening. It also directly helps the child to develop the clear speech. They will not function adequately over a period of a time if they are not maintained properly. Adequate care and maintenance ensures that the hearing aid have a longer life. You must maintain your device. There are two reasons why. The first, to retain the optimum hearing condition, and second, to ensure the high hygiene standards. The proper daily cleaning of a regular service will increase the life of the device and ensure that it performs satisfactorily. What do's and don'ts we need to keep in our mind while using the hearing aid device? Number one, the hearing aids are very delicate instruments and should be handled with care. It should keep in a safe and a cool place, should not drop down, it should not fall on the hard surface, it might get damaged. The microphone, the amplifier circuit or receiver could be damaged, resulting in no sound from the hearing aid. When putting on the hearing aid or taking it off from the child's ear, make it a practice to sit with the child on a bed or any other soft surface so that even if the aid were to fall, the chances of a damage are minimized. This should be practiced at least until the child is very comfortable with the aids and does not resist when the parent is putting it on the child's ear. The hearing aid user uh, should take an extra care to ensure that the hearing aid is in child's proof to extend the possibility. Well-fitting harness for the body level hearing aid, such that the aids are securely held at the chest position with no cloth obstructing or rubbing against the microphone. The straps of the harness should contain a space through which the cords can be passed. This ensures that the cords are protected from getting entangled, pulled or bitten. It is shown in the picture. You can just imagine how the harness should fit it in the on child's body so that we can put the hearing aid properly. The BT can be secured with the hearing aid retainers, which are rubber rings that go around the child's ear and keep the BT against the ear. As you can see, this is a rubber ring. To be extra sure that the child cannot throw the hearing aids away, use a spectacle cord, which is shown like this. Pass the rings of the cord through the ear hook of the BT and then pin the cord to the back of the child's dress. Some manufacturers also provide a volume guard, which is very effective in preventing a small child from manipulating the volume control. We should also take care that the moisture or heat dust cannot damage the hearing aid. So do not let the aid get wet. If the water goes into the aid, the microphone circuit can get short or the diaphragm of the receiver can get rusted. The dirt or the face powder can settle on the diaphragm of the microphone, causing the damage to it and resulting in distorted sound. Also, we should keep in mind that in the night, we should keep the aid in a dry aid kit, which can be purchased from the hearing aid manufacturer. The material in the dry aid kit will absorb the moisture that may have collected in the hearing aid due to the sweat, etc. The moisture due to the humid weather can damage the microphone of the hearing aid. Replacing the microphone can can be expensive. So this is a very important tip, specifically the places near the coastal area. The parents should keep the hearing aid always in the dry box when it is not in a use. It also should not keep near any electronic device, or should be kept away from the direct heat. The battery should always be removed from the hearing aid when the aid is not in use. It will prevent any inadvertent leakage of the battery from the damaging hearing aid. The battery contacts in the battery compartment of the aid should be kept free of corrosion. Do not use batteries which gives rise to a suspicion that they are leaking. Do not buy more than 3 or 4 batteries at a time. The BTA batteries often come with the stickers on them. Keep the sticker tightly stuck on the positive terminal of the battery whenever the battery is not in use. This will prevent the battery from discharging and will increase the life of it. If using a solar battery charger, ensure that the battery has been exposed to the sun for the recommended length of a time so that it has charged properly. Ensure that charging is coordinated, so there is always a charge battery available whenever the child requires it. Ear mold should be detached from the receiver of the body level hearing aid or from the BT of the hearing aid, BT hearing aid before they are washed. Use a mild soap diluted in the water to wash the mold. Ensure that the mold is completely dry before it is reattached to the receiver. A blower can be used to blow out any water that remains in the tubing. It is the best to wash the ear molds at the night so that they are dry in the morning and can be used. Ear mold must be kept clean and free of a dirt and wax. Dirty ear molds can even lead to infection to the ear canal. Wash the mold at least once in a week. As the child grows, the shape and size of the ear changes, thus making it necessary to make a new ear molds. New molds should be made whenever the child outgrows the molds. The molds that are too loose may frequently fall out of the ear, or there might be a consistent squealing sound coming from the hearing aid, even when the child is wearing it and the volume is kept at the correct position. Do not allow the cord of the body level hearing aid to get twisted or knocked. Make sure that they are hidden in the straps of the harness so that the child does not get a chance to pull them or bite them. Twisting or knotting the cords can result in leakage of the cord leading to no sounds. If the child is using a hearing aid with a bone conductor vibrator, ensure that the vibrator is never dropped on the hard surface. Ensure that it is placed on child's head in a proper position that is comfortable. Make regular visits to the audiologist so that the benefit that the child gets through the hearing aids can be monitored. The audiologist can also test whether the hearing aids are working satisfactorily by doing the analysis of electroacoustic characteristics of hearing. Thank you.